Recognizing the member for Vernon-Monashee.
Thank you and welcome, Madam Speaker. I want to thank the member from Caribou North for her statement and her advocacy. As I mentioned in my previous statement, that our government is taking action by making historic investments and taking major steps to fix our healthcare system and to support healthcare workers, so people can get the care they need and when they need it. Previous member asked about the outlines and stats and the numbers. I encourage member to, if she can, read through our health human resource strategy, which we finally now have. It outlines 70 actions that will help and focus on retention, redesign, recruitment, and training. I remember advocating, along with many of my union members, Madam Speaker, to seek support for our healthcare workers and for internationally educated nurses. My advocacy work for healthcare workers started in early 2000s, when I repeatedly saw many people struggling to get timely access to quality care and many lost lives, and staff struggling with workload and safety issues. And I remember the days when I had to go back to medroom to cry, and when staffing workload issues were there. I remember coming to the legislature lawn along with many BC Nurses Union advocates during several rallies, and that over a decade and a half. Then I came in this chamber and gallery for the first time there in April 2014. Again, tried to lobby with the government of the day. Member from Vancouver Kensington and her colleagues were very supportive, and they heard our struggles. Fast forward, here we are now, and I am so happy that our present government making significant changes and investments to support internationally educated healthcare professionals. As a healthcare professional, knowing that our government is sincere and committed to continue the work to make healthcare system better is so reassuring. And seeing these concrete actions is refreshing. Madam Speaker, we know that more work needs to be done and actions are constantly being taken. However, we're seeing the positive impact people are facing. I talked to several people and my healthcare colleagues, and they appreciate these ongoing efforts. I also recently saw a social media post in my local social media by a mom from Vernon who raved regarding the exceptional quality care her 7-year-old received, and within an hour, I don't have time to quote the entire. She said from getting admitted, getting seen, getting medication and treatment, it was 1 hour, and received exceptional care. I then talked to healthcare workers, and they said, this is what happens when we get the supports we need. I'm confident that our government's commitment and ongoing work and historic investments to support healthcare workers will help, whether they're trained in Canada or internationally. We will continue to see the progress and will continue to making steps in the right direction. Thank you, Madam Speaker.
Thank you, member.